ankle joint, which is also called as talocrural joint, located in the lower limb at the junction where the leg and foot meet with each other. It is formed by the bones of the leg, that is tibia and fibula, and the bone of the foot, that is talus. So today we are going to study in detail about the ankle joint. So first, the learning objectives of today's lecture are: at the end of lecture you should be able to describe the ankle joint, the type of the joint, articular surfaces and the joint capsule. You should be able to discuss the superior and inferior tibiofibular joint, describe the movements performed at these joints, discuss the neurovascular supply of these three joints. Now the ankle joint is the hinge type of synovial joint. It is formed by the distal end of the tibia and fibula and superior part of the body of the talus. So this is the ankle joint, which is formed by the distal end of the tibia and fibula and superior part of the body of the talus. Now the distal end of the tibia and fibula, along with the inferior transverse ligament, forms a bracket-shaped socket into which the trochlea or the pulley-shaped trochlea of the talus fit. Now look at this picture. The inferior end of the fibula, which is small, is anchored firmly with the large end of the tibia by the inferior transverse ligament. So the distal ends of these two bones are anchored firmly by this inferior transverse ligament. Now these two bones, the distal ends of these two bones along with the inferior transverse ligament, forms a bracket-shaped socket into which the superior part of the body of the talus fits. The superior part is pulley-shaped. Look at the picture. This is the bracket-shaped socket, this one. The arrow, this arrow is showing the bracket-shaped socket, which is formed by this is the distal end of the tibia, the medial malleolus of tibia. This is the lateral malleolus of fibula. So this bracket-shaped socket is formed by the distal end of the tibia, the medial malleolus of the tibia and the lateral malleolus of the fibula, into which this pulley-shaped superior part of the talus fits. As we are saying that there is a bracket-shaped socket which is formed by the inferior end of tibia and fibula along with the inferior transverse ligament. So this bracket-shaped socket, this is the bracket-shaped socket. It has a roof which is formed by the distal end of the tibia. This is the roof which is formed by the distal end of the tibia. It has a medial side which is formed by medial malleolus of tibia, and it has a lateral side which is formed by lateral malleolus of fibula. So the ankle joint is formed by three bones: the tibia, fibula and the talus. Simply we will say that the ankle joint is formed by the articulation of three bones: the tibia, the fibula, which are the bones of the leg, and the third is talus. And now which parts of the tibia and fibula? The distal end of the tibia, medial malleolus of the tibia, lateral malleolus of fibula, as well as superior part of the body of the talus. These are the parts of that particular bones which take part in the formation of ankle joint. Now this bracket shaped socket provides great stability to the joint. We have discussed that the distal end of the tibia as well as the two malleoli, that is medial malleoli of the tibia and lateral malleoli of the fibula, take part in the formation of ankle joint. Now remember that the two parts of the tibia are involved in the formation of joint, that is distal end and medial malleolus. Fibula, which part of fibula is involved? Lateral malleolus. Which part of talus is involved? Superior part of the body of talus. Now come to the second point. The second point is that the anterior part of the body of talus is wide as compared to the posterior part. This is the body of the talus which fits into this bracket shaped socket. Look at the picture. This is the distal end of tibia, this is the medial malleolus of tibia, and this is the lateral malleolus of fibula. These three parts, the two bones with three parts, forms the socket into which this talus fit. And this talus has a wide anterior part and the narrow posterior part. Two movements occur at the foot, the dorsiflexion and the plantarflexion. Now come to this point, the malleoli, that is medial and lateral malleoli, grip the talus tightly as it rocks in this bracket shaped socket during movements of the joint. Which movements? Dorsiflexion and plantarflexion. Clear? The malleoli grip the talus in this bracket shaped socket during the dorsiflexion and plantarflexion of foot. Now the grip of malleoli on the talus. The grip of malleoli on the talus is strong during dorsiflexion, because during dorsiflexion, now look at the picture, during dorsiflexion, this is dorsiflexion, look at the direction of arrows. During dorsiflexion, the wide anterior part fits into the socket between two malleoli. During dorsiflexion, the wide anterior part fits into the socket. The grip of the malleoli on the talus is strongest during dorsiflexion of the foot, because this movement forces the wide anterior part of the talus posteriorly, means in the socket, between the medial and lateral malleoli, causing them to even spread slightly. This spreading is limited by the ligaments of the ankle joint. Especially there are multiple ligaments of the ankle joint, but these three ligaments, that is intraosseous tibiofibular ligament, anterior and posterior tibiofibular ligaments, they are responsible to limit the spreading of the malleoli during the dorsiflexion. Second point is that the ankle joint is relatively unstable during plantarflexion. Now look at the picture again and look at the direction of the arrows. Now during plantarflexion, this narrow posterior part, look at the direction. Plantarflexion, during plantarflexion, in this direction, downward, this posterior narrow part fits into the socket. As we are saying, the posterior part is narrow, so this posterior part do not completely or do not properly fit into the socket during plantarflexion because it is narrow. So during plantarflexion, this part is during plantar flexion the joint is unstable because when the narrow posterior part fits, it do not fit properly. It is loose in the socket. The joint is unstable during plantar flexion because the trochlea is narrow posteriorly and therefore lies relatively loosely within the socket. It is during plantar flexion that most injuries of the ankle occur. Now look at this picture. The ankle joint is formed by the distal end of tibia, by medial malleolus of tibia and by lateral malleolus of fibula. These parts form a bracket-shaped socket into which the body of the talus fit. The body of the talus is wide anteriorly and narrow posteriorly. During the dorsiflexion, the wide anterior part, look at the direction of arrows, this is the direction of dorsiflexion, upward. During dorsiflexion, the wide anterior part fit properly into this bracket-shaped socket. So during dorsiflexion, the joint is stable. What happened in the plantar flexion? Look at the direction of plantar flexion. This part, narrow posterior part, fit into the socket. So as this posterior part is narrow, so this part does not fit properly in the socket. It is relatively loose in the socket. So for this reason, during the plantar flexion, the joint is unstable as compared to the dorsiflexion, because in the dorsiflexion, because of proper grip of the wide anterior part between the two malleoli, the joint is stable. Now the ankle joint, come to the articular surfaces. The articular surfaces are covered by hyaline cartilage and the joint is surrounded by the fibrous capsule. So first, the articular surfaces are covered by hyaline cartilage. These are the articular surfaces. The one is distal end of tibia. Second is medial malleolus of tibia. Third is lateral malleolus of fibula. And the fourth is superior part of body of talus. All these four articular surfaces are covered by hyaline cartilage. As this is the synovial joint, so in between these articular surfaces there is the presence of articular cavity or the synovial cavity. Now this joint, the articular surfaces are covered by hyaline cartilage like other type of synovial joint, and it is surrounded by joint capsule. Now you have studied earlier that the joint capsule of synovial joint consists of two layers, the inner synovial membrane and the outer fibrous membrane. The inner synovial membrane encloses the articular cavity and it is attached to the margins of the articular surfaces. Now look at the picture. This is the inner synovial membrane which is attached to the margins of the articular surfaces and encloses the articular cavity. The outer fibrous membrane is attached to the margins of the adjacent bones because it is present outer to the synovial membrane, and this is the outer fibrous layer which is enclosing the joint completely. This is another picture. The first picture is showing the articular surfaces which are covered by this grey colored hyaline cartilage, and this is the second picture which is showing the joint capsule having two layers, inner synovial membrane and outer fibrous membrane. Inner synovial encloses the synovial cavity or the articular cavity and is attached to the margins of the articular surfaces. whereas the outer fibrous membrane encloses the joint completely, so it is attached to the margins of the adjacent bones. The joint is further stabilized by the ligaments. So in the ankle joint, two groups of ligaments are present. On the medial side, this is the medial side of the ankle joint. On the medial side, there is the presence of medial ligament, and on the lateral side, this is the lateral view of the ankle joint. On the lateral side, there is the presence of lateral ligaments. The first is medial ligament. The medial ligament is large, strong and triangular in shape. Triangle means it has an apex and a base. The apex is attached to the medial malleolus of the tibia. This is the medial malleolus of tibia. So the apex of this triangular ligament is attached. This whole is the medial ligament. This is the medial ligament. The apex is attached to the medial malleolus, whereas the wide base, the base is broad, which extends from the tuberosity of the navicular bone. This is the tuberosity of the navicular bone to the medial tubercle of the talus. Look at this whole line. So the apex of this triangular shaped ligament is attached on the medial malleolus, whereas the wide base extends from the tuberosity of navicular bone, this is the tuberosity of navicular bone, to the medial tubercle of talus. So as we have discussed that the apex is attached on the medial malleolus, but the base is wide, which is attached at multiple parts of the bones of the foot. So on the basis of the distal attachment of this medial ligament, this ligament further subdivided into 4 parts. So you have to remember that there is a medial ligament which is strong with an apex at the medial malleolus and a base which extends from the navicular bone to the bone of the talus. On the basis of distal attachment, it is further subdivided into 4 parts. The one is tibiocalcaneal. As the name indicates, tibiocalcaneal means superiorly it is attached on the medial malleolus of tibia, but inferiorly it is attached on the calcaneum. Superior attachment of all these 4 ligaments is same, that is medial malleolus. The difference is in the inferior attachment. So the first is tibiocalcaneal, which is the central in position, and it is attached on the sustentaculum tali of calcaneus bone, this part. The second is tibionavicular. The second is tibionavicular. Again with the name, superiorly on the medial malleolus of tibia and inferiorly it is attached on the tuberosity of navicular bone. This is tuberosity of navicular bone. So inferiorly this tibionavicular ligament is attached on the tuberosity of navicular bone, but it also extends to the plantar to this plantar calcaneo-navicular ligament. This plantar calcaneo-navicular ligament is not the ligament of the ankle joint, it is separate ligament which connects the navicular bone to the calcaneum. So this ligament, the medial ligament of the ankle joint, the tibionavicular part of this medial ligament is attached on the tuberosity of navicular bone, but it also attached with the plantar calcaneo-navicular ligament. The third ligament is anterior tibiotalar. Again, as the name indicates, superiorly on the tibia. Inferiorly, it is attached on the medial surface of the talus. And this anterior tibio-talar ligament lies deep to these two ligaments, that is tibio-calcaneal and tibio-navicular. The fourth ligament is posterior tibio-talar, again on the medial malleolus of tibia, and inferiorly it is attached on the medial tubercle of talus. This is another picture which is showing the ligaments. The medial ligament, which is also called as deltoid ligament, consists of four parts superiorly attached on this medial malleolus, but their inferior attachment is different. On this basis, this medial ligament consists of four parts. This first is tibio-calcaneal, which is attached inferiorly on the sustentaculum tali of the calcaneus. The second is, this is second, which is tibio-navicular, which is attached inferiorly on the tuberosity of the navicular bone. The third is anterior tibio-talar, which is attached on the medial surface of the talus. And the fourth, this one is posterior tibio-talar, which is attached on the tuberosity of the talus. The second group of ligament are the lateral ligament. The ligaments which are present on the lateral side are again of three types. The one is calcaneofibular ligament. Second is anterior talofibular, and the third is posterior talofibular. The medial ligaments are attached superiorly on the tibia. The lateral ligaments are attached on the fibula. Medial ligaments attached superiorly on the tibia, and their inferior attachment is different. On the lateral side, the lateral ligaments are attached on the fibula. That's why the names are given as calcaneofibular, talofibular, and anterior and posterior talofibular. Clear? Now come to the ligaments. The first is calcaneofibular. This is calcaneofibular. Now this ligaments extends from the malleolar fossa up to the lateral surface of the calcaneum. Now recall the osteology of fibula. You have already gone through the osteology of fibula, and in the fibula you have discussed that the malleolar fossa is present on the posteromedial surface of the lateral malleolus. Look at this picture. This is malleolar fossa. This is lateral malleolus of fibula. This malleolar fossa is present on the posteromedial. This is the posterior aspect, and this is the medial aspect of the fibula. So you have to remember that the malleolar fossa is present on the posteromedial surface of fibula. So the calcaneofibular ligament, the first lateral ligament, extends between the malleolar fossa and the lateral surface of the calcaneum. The second is anterior talofibular ligament. This ligament extends from the anterior surface. This is the lateral malleolus. So the anterior talofibular ligament extends from the anterior surface of the lateral malleolus to the anterior part of this adjacent talus bone. The posterior talofibular ligament extends from the malleolar fossa, which is present on posteromedial surface of the lateral malleolus. So this posterior talofibular ligament extends from the malleolar fossa to the posterior process of talus. This is posteriorly placed ligament. So there are three lateral ligaments. The one is calcaneofibular, this one, which extends from the malleolar fossa to the calcaneum. Second is anterior talofibular, which extends from the anterior surface of lateral malleolus to the adjacent part of the talus bone. Third is posterior talofibular, which again extends from the malleolar fossa to the posterior process of the talus. Now the movements of the ankle joint. We have discussed earlier that the ankle joint is a hinge type of synovial joint. So two movements are possible at this joint, that is dorsiflexion and plantarflexion. If we will talk about the movements at the foot, then four movements of foot are possible. The first two are dorsiflexion and plantarflexion. Now you have to remember that these two movements, that is dorsiflexion and plantarflexion, occurs at the ankle joint. The remaining two movements of the foot, that is inversion and eversion. The inversion and eversion movements also occur at foot, but these two movements do not occur at the ankle joint, but they occur at the subtalar joint, which is present below the ankle joint. Now the blood supply of ankle joint. The ankle joint is supplied by the fibular artery, anterior tibial artery, and the posteriorly placed posterior tibial artery. So it is supplied by three arteries, the malleolar branches of the fibular artery, this one, the fibular artery, anterior tibial artery, and posterior tibial artery. The nerve supply of the ankle joint is through the deep fibular nerve. This is deep fibular nerve and the tibial nerve. Now the clinical conditions associated with the ankle joint. The ankle joint is the most commonly affected or most commonly injured joint because it is located at the junction of the leg and the foot. So the most common clinical conditions associated with the ankle joint include the ankle sprain. The ankle sprain is an injury to the tough bands of ligaments that surrounds and connects the bones of leg and foot together. The injury typically happens when you accidentally twist or turn your ankle in an awkward way. This can stretch or tear the ligaments that hold your ankle bones and joints together. The ligaments, they are mainly responsible to stabilize the joints, preventing excessive movement. So a strained or sprained ankle occurs when ligaments are forced beyond their normal range of motion. So the ankle sprain occurs when there is a stress on the ligaments. So if we will talk about the ligaments of the ankle joint, then there are two groups of ligaments we have discussed in detail, the medial ligament and the lateral ligament. So there are two types of strain, the sprain of lateral ankle and the sprain of medial ankle. So first, the sprain of lateral ankle. This is the lateral side. So the sprain of lateral ankle is caused by excessive inversion of foot with plantar flexion of ankle. So sprain of lateral ankle occurs because of two reasons. The one is excessive inversion of foot and the second is plantar flexion. Now why the excessive inversion causes the sprain of lateral ankle? Invert your foot. Now during inversion of foot, the stress or the pressure will be on the ligaments which are present on the lateral side. Clear? So during excessive inversion, there is stress or stretching of the ligaments of the lateral side of the ankle. The second reason is plantar flexion. We have discussed earlier that during the plantar flexion, the joint is unstable because the posterior narrow part of the body of talus do not completely fit into the bony socket of the ankle joint. So, the sprain of lateral ankle is caused by excessive inversion of foot. When there is excessive inversion, then there is a stress on the lateral ligaments of the ankle joint, results in tearing of the ligaments. Now, you have already studied that there are three ligaments on the lateral side: the calcaneofibular, anterior talofibular, and posterior talofibular ligament. Out of these three ligaments, the calcaneofibular ligament and the anterior talofibular ligaments are mainly torn during the sprain. The second is acute sprain of medial ankle. Now, the sprain of medial ankle is less common because we have discussed that the ligaments which are present on the medial side are strong as compared to the ligaments which are present on the lateral side. So, the ligaments which are present on the medial side are strong. For this reason, the sprain of the medial ankle is less common. This sprain is caused by excessive eversion of foot. Eversion of foot and plantar flexion. Again, plantar flexion in plantar flexion joint is unstable, but when there is excessive eversion, then the stress will be on the ligaments of the medial side, which results in the sprain of medial ankle. The symptoms of sprain overall are pain, swelling, bruising, and restricted movements. The second clinical condition associated with the ankle joint is dislocation or fracture of the ankle joint. The ankle joint and related structures can be regarded as a fibro-osseous ring. This is the ankle joint. Now, the parts which take parts in the formation of the ankle joint as well as the surrounding parts are considered as a fibro-osseous ring. The upper part of the ring is formed by the joint between the distal end of the tibia and fibula. This part. The upper part is formed by the joint between the distal end of the tibia and fibula and by the ankle joint itself. These two parts or these two joints, the inferior tibiofibular joint, because in between the distal end of tibia and fibula there is the formation of inferior tibiofibular joint, and this is the ankle joint. These two parts form the upper part of the fibro-osseous ring. The sides of the ring are formed by the ligaments that connect the medial and lateral malleolus to the tarsal bone. Upper part is formed by the joint and the lower part is formed by the sides are formed by medial malleolus of tibia and lateral malleolus of fibula. The bottom of the ring is not part of the ankle joint itself but consists of the subtalar joint and the associated ligaments. Now the fracture of the ankle depend on the pressure or force and on the site of the ankle joint. There may be fracture of the medial malleolus. This is the medial malleolus, in which the distal end of the tibia is fractured. There may be fracture of the lateral malleolus, in which the lateral malleolus of fibula is affected. there may be fractured posterior malleolus. The one is fracture of the medial malleolus. Second is fracture of lateral malleolus. And the third is fracture of posterior malleolus of tibia. Now this fracture occurs when there is a fracture of the lateral malleolus. The reason is that this posterior malleolus and this lateral malleolus share the same ligaments. So the fracture of posterior malleolus mainly occurs when there is fracture of lateral malleolus. The reason is that these two malleoli share almost same ligaments. The last is ruptured syndesmosis ligament. This type of fracture mainly occurs at this part, inferior tibiofibular joint. Clear? So this fracture, the ruptured syndesmosis ligament, occurs when there is a fracture of the inferior tibiofibular joint, as well as when there is a fracture of the ankle joint also, because of the intraosseous membrane. The intraosseous membrane which connects the shafts of the tibia and fibula. So, and this intraosseous membrane, there is some ligaments which extend from this intraosseous membrane, which we will discuss in the tibiofibular joint. In the tibiofibular joint, there is the ligament which is the extension of the intraosseous membrane. So when there is a rupture of this intraosseous membrane, or when there is a rupture of this ligament which is the extension of the intraosseous membrane occurs, then we will say that there is ruptured syndesmosis ligament. Intraosseous membrane is present which connects the shaft of the tibia and fibula. There is one ligament, the intraosseous ligament, which is the extension of the intraosseous membrane. This intraosseous ligament provides stability to the distal tibiofibular joint, which we will discuss later on. So when the distal tibiofibular joint is affected, this part, then there is rupture of the intraosseous ligament or the associated intraosseous membrane. This type of fracture is called as ruptured syndesmosis ligament, in which there is rupture of intraosseous ligament or the intraosseous membrane. The third is tibial nerve entrapment. Now the tibial nerve leaves the posterior compartment of the leg. This is the posterior compartment of the leg. The tibial nerve passes the posterior compartment of leg by passing deep to the flexor retinaculum. So the tibial nerve passes in the interval between this medial malleolus and the calcaneus. Entrapment and compression of the tibial nerve, which is also called as tarsal tunnel syndrome, occurs when there is either a fracture on the medial side of the ankle, or when we can say there is edema or the tightness in the ankle. This results in the heel pain. So this all is about the ankle joint. Now this is the picture. Now recall the ligaments of the medial side of the ankle joint. First, medial ligament. Apex is attached on medial malleolus of tibia. Base is attached on a line which extends from tuberosity of navicular bone to the medial tubercle of talus. There are 4 ligaments. Identify this ligament. Tibiocalcaneal ligament. Identify this ligament. Tibio-navicular. Identify this small ligament. Tibio-talar. Anterior tibio-talar. This ligament is posterior tibio-talar. So the second part of today's lecture is tibio-fibular joints. In the tibio-fibular joints, the tibia and fibula are connected by two joints, the superior tibio-fibular joint at the superior end and the inferior tibio-fibular joint at the inferior end. The second is atrocious membrane, which joins the shafts of the tibia and fibula. Now this is the superior tibio-fibular joint. This is inferior tibio-fibular joint. The first is superior tibio-fibular joint, which is plain synovial joint. Articulation is between the lateral condyle of the tibia and the head of fibula. The articular surfaces are covered by hyaline cartilage and they are surrounded by a capsule. In addition to the capsule, further strength is provided by the anterior and posterior ligaments. This is anterior ligament of the joint, and on the posterior aspect there will be posterior ligament of the superior tibio-fibular joint. Further stability is provided by the atrocious membrane. Now the movements, only slight movement occurs at the superior tibio-fibular joint during dorsiflexion of foot. Now come to the blood supply of the superior tibio-fibular joint. The superior tibio-fibular joint is supplied by inferior medial genicular artery. This is inferior medial genicular artery and anterior tibial recurrent arteries. This one, recurrent branch of anterior tibial artery. So it is supplied by two arteries. The one is this one, inferior lateral genicular, inferior lateral genicular. The first is inferior lateral genicular and the second is recurrent branch of anterior tibial. This is inferior lateral genicular and this one is anterior tibial. It is supplied by common fibular nerve and nerve to popliteus. The second is inferior tibio-fibular joint. This is compound fibrous joint. The articulation is between the fibular notch at the lower end of tibia. This is the fibular notch at the lower end of tibia and a rough facet on the lower end of fibula. It is not surrounded by a capsule, but it is supported by a group of ligament. The first is atrocious ligament. This is a strong, thick band of fibrous tissue that binds the bones together. It is continuous superiorly with the atrocious membrane. Now, this is the ligament which is responsible for the rupture of this. This ligament is responsible for the ruptured syndesmosis ligament. When this ligament is fractured, then this condition occurs. So the first is atrocious ligament, which is continuous superiorly with the atrocious membrane. Then anterior and posterior tibiofibular ligaments. Anterior tibiofibular ligament and posterior tibiofibular ligament, which are flat bands of fibrous tissue connecting two bones together in front and behind the atrocious membrane. Atrocious membrane joins the distal end of two bones. Anterior tibiofibular in front of the atrocious membrane on the anterior aspect, posterior tibiofibular behind the atrocious membrane. Then there is inferior transverse ligament, which connect the distal end of the tibia and fibula, or we can say the medial and lateral malleoli. And this joint is also supported by the interosseous membrane. Again, slight movement occur at this joint during dorsiflexion of foot. Blood supply is perforating branches of fibular artery. This is fibular artery and anterior